My name is Yesenia. I'm a student nurse. I'm going to be performing a head to toe assessment today. Is that okay?
Yes.
Okay. I'm going to begin by washing my hands. Washing my hands. Okay. As I enter the room, I'm going to be inspecting the patient as well as the environment to make sure that there's no safety hazards. I'm visually looking at my patients to see the demeanor and if the patient's in any visible distress. My patient's demeanor is calm and patient presents with no visible distress that is noted. All right, sir. I'm going to begin by asking for your first and last name and your date of birth.
My name is Jose Torres and my date of birth is 11/26/95.
Okay, I'm going to be comparing the information with the patient's armband as well as the electrical charts that I have at bedside. So I'm going to ask you a few questions, okay? I'm going to begin by asking if you know the name of this building.
This is South Florida State College Hospital.
Okay, can you tell me what month or year it is?
The month is November and the year is 2019.
Okay, can you tell me what's the name of our current president?
Donald Trump.
Okay, patient's alert and oriented ×4. I'm going to also assess your cranial nerves, and I'll begin by assessing your eyes. Okay, have you experienced any blurry vision or any abnormalities that you've noticed with your eyes?
No.
Do you wear any corrective lenses such as glasses or contacts?
No.
Okay. Do you have any family history of any eye disorders such as cataracts, anything like that you noticed, blurry vision, glaucoma? Okay. So I'm going to ask you to take a look at my nose. As the patient's looking at my nose, I'm checking to make sure that your eyes are round and your pupils are equal. Your pupils are equal and your eyes are round. I am going to be flashing a light in your eye, okay?
All right.
Okay, so take a look at my nose still. Okay. Side line, good job. Good job. Then I'm going to do the opposite side. Good job. Good. All right. You okay?
Yeah, I'm good.
All right. So I'm going to ask you to take a look at my nose. Good job. Now take a look at my finger and then follow my finger with your eyes, okay? Try not to move your head. Good job. Okay, follow my finger. You're doing good. Okay, so patient has parallel pupils are equal, round, and reactive to light. All right. Now I am going to also inspect the facial nerve of the patient. So I'm going to ask you to squeeze your eyes together. Good. And open your eyes. Good. Lift up your eyebrows. Great. And can you frown for me? All right. Awesome. Can you smile for me now? Good. And can you make some puffy cheeks? Good job. Now I'm going to use the end of my cotton stick and I am going to feel. You let me know if you feel anything.
Okay.
Can you close your eyes for me? All right.
I felt you touch my part of my face, my cheek.
Good. And then close your eyes again.
Right cheek.
Good job. All right. Have you been experiencing any swallowing difficulties or any choking episodes that you're aware of?
No, I have not.
Okay, good. And I may ask you to stick out your tongue for me. Good. I'm just going to be flashing a light into your mouth just to see your cavity. And can you say, ah? Good job. Good job. All right. Now I'm going to ask you to stick out your tongue one more time. Tongue is midline, no deviation noted. And can you stick out your tongue again? And then can you swipe it side to side? Move it side to side. Good. So facial, ocular motor, glossopharyngeal, and hypoglossal nerves are intact. I'm also going to be checking your ears, okay? Have you been experiencing any ringing in your ears?
No.
Any hearing loss? Do you have any family history of any cochlear implants or any hearing loss there? Do you have any deafness in any ear?
No.
No? Okay. I'm going to be inspecting it externally, making sure that there's no abrasions, scratches, anything like that, or any lesions. I don't notice any. I'm going to lightly feel your ear to feel any nodules. Good. Don't feel any on that side. Good. No nodules fell on that side. Now I'm going to be flashing a light around your ear to make sure I don't notice any foreign objects, okay? Good. Good job. Now I'm going to ask you to close your eyes and I'm going to be making a sound. You let me know if you hear a sound and what it sounds like to you. Okay, so close your eyes.
Here's like your fingers going together on this side.
Good job. Can you close your eyes?
Same thing on this side.
Okay, good job. So vesicular cochlear nerve is intact. All right, now I'm going to be checking your spinal accessory nerves. Okay, so what I'm going to ask you to do is to sit a little bit forward. Great. And I'm going to be placing my hands on your shoulders, and you shrug your shoulders up. Good job. Now I'm going to ask you to turn your head towards the right side. I'm going to be pushing against you slightly. Turn your entire head. Good job. Do you have any pain when you do that?
No, I do not.
Okay, good. So your accessory nerve's intact. Great. Now what I'm going to do is I am going to be assessing your lung sounds.
Okay.
Okay, so I have my stethoscope here, and I am going to be cleaning it with my alcohol. So I'll place that there. Sorry, just making sure that it's clean. Alright, have you been experiencing any shortness of breath?
No.
No. Do you have any type of pulmonary disorders or conditions such as obstructive obstetric pulmonary disease or any shortness of breath, any asthma, anything like that to your knowledge?
No.
Okay. So I'm going to be listening to your front part of your body, and then I'm going to ask you to move forward and listen to the back, okay?
All right.
Alright. Good. Good. Good job. No adventitious lung sounds noted in the anterior area. Now if you can move forward just slightly. Great. I'm going to be listening to your back side. Take a deep breath. Good. Deep breath. Deep breath. And then 2 more times. Good. Good. You can lean back. No adventitious lung sounds noted. Are you feeling okay? Any dizziness?
I'm fine. Maybe for breathing so much, but I'm fine.
Okay. 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 Now I'm gonna ask you to grip my fingers with your hands, squeeze them as tight as you can. Good job. And then lift up against my arm or my hands. Good job. Lift down. Good job. Okay. Now, since I'm going to go ahead and assess your abdomen area. Have you been experiencing any abdominal pain? When's the last time you had a bowel movement?
This morning.
Okay. Was it pretty normal for you? Was it solid or was it formed?
Normal and brown.
Okay. Have you been
Fully
having
brown.
any diarrhea or constipation to your
No,
knowledge?
ma'am.
No. Do you have any kind of conditions that are in your abdomen area, such as Crohn's disease, diverticulitis,
No.
anything like that? No.
You won't miss it.
That's good. Are you in a comfortable position?
Yeah, I'm comfortable.
Okay, so I'll be inspecting the abdomen area. Abdomen looks round, no abnormalities noted. I'm now going to be auscultating, okay? Gonna. All right, good job. All right. So bowel sounds active ×4. Now I'm going to be doing a soft palpitation on your abdomen area. Okay. You let me know if you're experiencing any pain. Any pain?
No.
Any pain?
No.
Any pain? Okay. Since I'm already in this area, I'm going to be assessing your bladder.
Okay.
So if you just want to lie a little bit more down, good job. You can place your shirt down for comfort. I'm going to be pressing down. You let me know if you have any pain. Okay. No pain? Okay. No distension in the bladder noted. You can sit up again. Thank you. Have you been experiencing any burning sensation whenever you urinate?
No.
Have you been having any discharge to your knowledge?
No.
All right. So I'm going to be setting my stethoscope down and I'm going to go ahead and assess your lower extremities, okay? So I'm going to ask you to do the same thing as we did on your upper arms. I'm going to ask you to push up against my hand. Good job. Let's not try to use your hands, just use your legs, okay? Up. Good job. Let's try to do both together next time, all right?
Okay.
So lift your legs up. Okay, now lift them down. Good job. Same thing for your feet. Lift them up against my hand. Good job. Lift down against my hand. Good job. At this, I'm going to be taking off your socks. Just slightly. We don't have to take them all off. Well, actually, I probably do, okay? So as I'm moving the areas of his legs, I'm determining if this patient has any pin and edema. I'm pressing up against his leg. No edema noted. No edema noted. I'm going to go ahead and feel for your posterior tibial pulses. Okay. Have you been experiencing any numbness or tingling in your lower extremities, in your legs? No? And I'm going to be feeling his pedal pulses at this time, since we're already at this area. Good. So posterior tibial and pedal pulses are +2. They're within norm. I'm going to go ahead and be removing your socks on this side. I'm just going to be checking your calf refill. Okay, calf refill less than 3 seconds. All right, I'm going to do it on the other side. All right. Good job. Calf refill less than 3 seconds.
Okay.
I'm going to be washing my hands at this time before I continue the assessment. Washing my hands. Okay. All right. So I'm going to ask if you can sit on the side of the bed, please. We're going to be doing some further testing. All right. How are you feeling? Are you feeling any dizziness?
Nope, I'm feeling great.
Okay. Now I'm going to ask you to do some and see if you can stand up for me, please. Good. Put your feet together. We're going to be doing what we call is a Romberg's test to check your stability of your gait and to see if you're balanced, okay? So I'm going to ask you to extend your hand out. Good job. And close your eyes. Good job. Now I'm going to be pushing against you. Let me know if you feel any dizziness or feel like... No? Good job. You can open your eyes now. Okay. Now we're going to be doing a heel to toe test, okay? What I'm going to have you do is stand forward and which 1 foot at a time. I'm going to ask you to put your feet with your heel in front of the other foot, touch with your toes, and continue in a straight line for a few steps.
Can we turn
Okay,
around?
that's good. You can turn around now. How are you feeling? Try to look at a straight line whenever you do that, okay?
Okay.
Let's try just a few more steps more with you looking forward. Okay, good. Good job. And turn around. Take a few more steps. Good job. How do you feel? Any dizziness?
No.
No? Okay. You can have a seat now. All right. So now what I'm going to do is I'm going to be checking your reflexes on some of your extremities, okay? Normally I would have some type of strong object to hit at this time, so I'm just going to be showing the areas that I would be palpating or striking against to get that reflex. So what I'm going to do is have you have your hand just slightly flex, just slightly. Good. I'm going to be placing my thumb in the brachial area to check your deep flexion in your brachial. I'm going to be placing it right underneath the muscle, and what I want the hand to do is flex a little bit while the upper portion of his arm stays extended. Okay, so I would normally hit here, and we would normally like to see a jump in the hand. Okay, good. I'm going to be doing the opposite side as well. I'm going to be having my thumb here in that area. I would be hitting with my stick to check the reflexes. Okay, now I'm going to be doing your palpatio reflex. So I'm going to be placing my hand here and hit against here. I would like to see that jump. Good. And then if you can just move this like just slightly a little bit. There you go. Good job. All right. Now what I'm going to do is I'm going to have you flex your arms forward if you can. Good. Now extend them. Great. If you can flex this leg up. Good job. Now extend it. Great. Flex this leg up. Now extend it. Great. Now I'm going to ask you to stand up because we're going to be doing, monitoring your back. You can stand right there. And if you can touch your toes as far as you can. Good job. I'm gonna go ahead and check your spine since you're in this area. Good, you can stand up. Do you have any pain when you do that?
No.
No? All right, now I'm gonna ask you to rotate side to side if you can. Any pain?
No.
No, okay, you can have a seat again. All right, I think my assessment is completed. Do you have any questions for me?
No, thank you so much.
Okay, I do have a little bit of educational teaching for you. What I want to inform you about is some healthy eating choices. So try to eat a lot more fruits and vegetables if you can. It is recommended for men to have at least 36 grams of protein. So make sure you get some protein foods such as you can do some beans, you can do some whole grains, you can do any meat products that have a lot of protein in it. You can try to do low-fat milk as well as low-fat yogurt that also has a lot of proteins and calcium in it as well. Okay, so just try to get and stay hydrated. We recommend at least 8 ounces of water a day, if possible, if you can maintain that to keep the kidneys functioning and keep your urine clean. Okay, so
I drink like 2 liters a day.
Well, that's good. So try to avoid any sugary drinks such as soda, any juices. Try to avoid any processed foods. And if you can, I know it's a little bit difficult, but if you can avoid any fast food restaurants, if you can avoid any snacking at night, such as eating some chips at night, because those are high in carbohydrates. So just make sure you drink lots of fluids, get a lot of veggies and fruits in, okay? Okay, so we can give you some information and pamphlets on those if you like that before your discharge. We can also recommend dietary to come up here to give you some additional healthy food sources. Okay.
Thank you so much.
Do you have any other questions for me? Any other concerns?
No.
Okay, if you want to lie back down on the bed, I will be placing the side rails up at this time, making sure that the patient has the bedside table within reach and the call light within reach. I'm making sure that my patient is not in visible distress before I leave the room and making sure that all questions and concerns have been answered. So you said you have nothing else for me?
No, thank you so much.
You're welcome. I will be gathering my supplies, washing them as I walk out. Thank you so much for allowing me to do my assessment today. I'm going to be washing my hands before I leave. And thank you.
Bye-bye.